Oh, thank you for joining this session. My name is Mark Altieri. I'm a vice president at Public Partnerships, and I have been here for 18 years. And I am very excited to introduce a colleague who I met almost 18 years ago. Kate Murray joins us, and when I met Kate, she was a policy analyst for the National Resource Center for Participant-Directed Services at Boston College. And if anyone on the call right now knows the acronym NRCPDS, you know that Kate is as much of an OG, as they say, as anyone in self-direction ever. I have learned a tremendous amount about self-direction from Kate over the years. Kate has expertise in a whole host of areas, but certainly Medicaid-funded self-directed programming. She has always been focused on labor and workforce issues, which in a post-COVID world have become front and center for many states. She played a major role in the Fair Labor Standards Act that had dramatic impacts in a good way on home care workers. She has also consulted and worked with Medicaid agencies around the country, MCOs around the country, and is honestly a tremendous asset to this industry and provides guidance and expertise to states on a regular basis on their self-directed models, how to improve them, and how to maximize the number of consumers that benefit from them. So I am as equally excited as all of you to hear Kate for the next 45 minutes, and I assure you we will all learn. So, Kate, thank you so much for joining us today.
Thank you so much, Mark, and thank you all for being here today. It's a great pleasure to get to continue to partner with PPL. We so appreciate all that they do for self-direction, and I'm really delighted to get to speak on this topic today because it is probably my favorite thing to talk about in terms of the world of self-direction is sort of where did this model come from and kind of how did we get here? So I do have some slides that we're pulling up and we'll jump in. So next slide, please. So first, we'll give just a very high-level overview of what self-direction is all about. I realize a lot of us on this call are already familiar, but just kind of as a level set. And then we'll look at kind of current participation in self-direction across the entire United States, and really look at what the enrollment trends are suggesting as far as what the future of self-direction might look like. It's very positive. I'll just give that as kind of the spoiler alert. And we will have some time for Q&A. So next slide, please. So when we talk about self-direction, this is also known, kind of depending on what state you live in, it's also known as consumer direction. It's also called participant direction. And this is one of those things that because this model has so many different names, it can be really hard to research what's going on in other states. This is something that we hear all the time where people are saying, I want to know what my neighboring state does, but I can't find what their program name is called, or their program doesn't look at all like ours. So we do have this issue nationally of using multiple terms to refer to kind of the same idea, but I just wanted to flag that in case you are interested in researching more. Self-direction does have a couple of different names, but when we say self-direction, we're really referring to a model of service delivery that helps people of all ages with all types of disabilities maintain their independence in their home and community. And the primary hallmark of self-direction is that the person is deciding how, when, and from whom their services and supports will be delivered. And so kind of key values of self-direction are that people should have choice, people should have control, and people should have flexibility when it comes to their services and their supports that they need to live their lives. So that in a nutshell is really what self-direction is all about. It's been implemented in a lot of different ways and with I would say with varying levels of kind of uptake, depending on the state that you're in. And we'll get into that later on in the presentation. So next slide, please. So when we also talk about self-direction, there are some hallmarks in terms of what these programs actually look like and what they offer. I already mentioned that, choice and control and flexibility are all really important to these programs, but Some of the things that are also important in self-direction are, for example, the freedom to develop schedules for workers. So, being able to set your own schedule is very critical, I think, for people who self-direct. Self-direction is all about innovative use of community resources. Self-direction is about honoring the dignity of risk and, making sure that people can make some poor decisions. Even if it's as simple as, maybe eating, choosing something for lunch that is not particularly nutritious. Sometimes I want to eat too much pizza. And that's part of the dignity of risk. And that's something that's, in small and, also bigger ways is really important as far as ensuring that people with disabilities have access to the community, have access to the same opportunities that people who don't have disabilities have. So as I mentioned before, flexibility is very important. Creativity is very important. Self-direction is all about out-of-the-box thinking and really kind of tailored services and supports that really support what that particular person is wanting to do with their lives. We try to get away from kind of cookie cutter service plans, and we really try to have a person-centered approach. And in programs like New Jersey, another really important hallmark of self-direction is around having choice of kind of what you're doing with your budget, whether that's purchasing something that's going to help you, or if you're choosing to spend your budget on service hours, having that kind of flexibility and being able to decide where you would like to spend those resources is something that self-direction is kind of unique in offering. So next slide, please. So when we talk about this model, it can be hard to pinpoint where exactly it came from, but I would say the real kind of national groundswell of support for what today we call self-direction really came out of the 1970s, where we had the independent living movement, and we had just a tremendous amount of advocacy by disabled people who made the case that they had the right to decide how to live their lives, which unfortunately at the time was considered somewhat novel from a policy perspective. But we saw kind of widespread closure of institutional settings. We really saw a focus on the independent living movement. And from that, we started to see kind of very early programs in which people who did have disabilities were making more decisions about their services and their supports than they had previously kind of had access to under existing service options. And so in the 1980s, we started to see some state-funded self-direction programs. We also started to see some personal care programs funded at the Medicaid level, in which people with disabilities could kind of start to select their own staff and decide who worked for them, rather than having to, just receive a worker from an agency and not have much choice over that decision. From the 1980s, we had this kind of slow and steady growth of really self-directed models. And in the 1990s, this movement was really galvanized by the Supreme Court decision, the Olmstead decision, which created this new precedent that people with disabilities had the right to live in the least restrictive setting. That was an incredibly important Supreme Court decision for people with disabilities. And that really galvanized state policy choices as far as continuing to move away from institutional settings and really trying to get people into the community and giving people more control over their services and by extension, their daily lives. We also started to see the federal government approve some really novel new self-directed options. And this was part of a national initiative made possible through the Robert Wood Johnson Foundation. If you read about the history of self-direction, you'll definitely hear the terms cash and counseling, which kind of pioneered the use of budget authority and giving people individual budgets, and they could figure out what mix of services and supports really worked best for them. They could hire their family members, they could hire really anybody of their choosing. And this was just a totally radical, at the time, new innovation. And we also had the self-determination initiative for people with developmental disabilities, which was also funded through the Robert Wood Johnson Foundation. And the nice thing is that these initiatives were formally evaluated by academic institutions, by policy experts. And we found that people who self-directed in these new programs really had excellent outcomes. Not only did people who self-directed had great outcomes, they reported higher satisfaction with their lives. They felt like they were doing more of the things that they wanted to do, but their caregivers also reported better outcomes as well than people who were receiving solely agency services. And so, through this in the 1990s, we started to see more federal buy-in. And that was particularly at the kind of chief agency that administers and funds the most self-directed services, which is the Centers for Medicare and Medicaid Services, or as we call them, CMS. And so CMS really bought into self-direction and really kind of formally embraced it, coming out of these national demonstrations that showed that, hey, this model really works, people really like it, and people want more of it. And so in the 2000s, kind of up to the present, we started to get, for example, some CMS guidance as part of the Affordable Care Act that strongly encouraged states to offer self-direction. It doesn't actually come out and require them to, but at this point, all states do offer at least some self-direction, not necessarily for every single population, but every state now offers some form of self-direction, some more than others. And as we'll get into later in the presentation, up to the present, we really have seen incredible growth in the self-directed model, and all indicators suggest that we're only going to see more really major growth in the years to come. So next slide, please. So just looking at what enrollment in self-direction looks like as of 2023. So our organization, Applied Self-Direction, does a national inventory of self-direction in partnership with AARP. We have done this with them every 3 to 4 years. And what we do is we try to research every single program in the country. Similar to the, for example, the PPP in New Jersey is on our list, and we tally up all the programs, including new ones that were just created within the last 3 years that we haven't tracked previously because they are so new. And then we call and put out data requests to every single administrator of these programs, trying to figure out how many people are enrolled in these programs. Because if you've ever tried to, Google this stuff or look around, it's very hard to get this data. But we do manage to get it in the end. It's a very time-intensive process, but every couple years, we do get kind of another snapshot of what national enrollment looks like. And so our latest data collection was in early 2023. And states reported back that over 1.5 million people were self-directing, and that was a 23% increase from our last inventory, which was conducted in 2019. So it's not only the most people ever, it's also a faster rate of growth, which indicates that more and more people are getting interested in self-direction and also choosing to use this model. So very, very, very exciting stuff. Next slide, please. So I'll just talk a little bit about how self-direction looks different across different states. So in our most recent inventory, again, this was last year, most states reported an increase in self-direction enrollment. Some of them reported a really big increase. A much smaller number of states reported a decrease. So 7 states reported a decrease. California continues to have most of the people self-directing, 48% of total national enrollment, because California is a very big state. A lot of people live there, and they've been doing self-direction for a very long time. So California has always had kind of the lion's share of self-direction enrollment. But the good news is that this percentage is trending downward since we started measuring in 2011. And it's not because less people want to self-direct there. It's just that more people are self-directing in other states. Other states are catching up. So it seems that as the years go on, California will account for less of the national total. And 6 states have more than doubled their self-direction enrollment since 2019. And those are Alabama, Connecticut, the District of Columbia, if you count that as a state, Florida, Maryland, and South Dakota. So in some states, we are seeing really, really, really big growth. The next slide, please. When we think about funding sources, I think the main takeaway here is that most self-directed services are funded by Medicaid. Medicaid funds, again, the majority of self-direction. There are other funding sources. For example, the Veteran-Directed Care Program is funded and administered through the Veterans Health Administration. So that's another really thriving self-direction program out there. But in terms of the number of people participating in the veteran-directed programs, it's much smaller than compared to the Medicaid option. There are some states, including New Jersey, that have some self-direction programs that are funded through just state dollars. There's no kind of federal dollars that you get through the Medicaid program. But those states are pretty unusual. So we had 12 programs that were just funded by the states themselves. And then there are a couple of other options in there. There's some smaller programs that are funded, for example, by the Older Americans Act. But again, I think the takeaway here is that most self-direction that's happening in the United States is really funded through Medicaid. Next slide, please. As far as, kind of who gets the option to self-direct, most states offer, they have at least kind of one self-direction program that's available for people over age 65, adults with physical disabilities, and adults with intellectual and developmental disabilities. So, again, it's hard to ever say 100%, but for the most part, for most states in the country, your state is probably going to have a self-direction program for older adults, for adults with physical disabilities, and adults with IDD. And I know New Jersey is in that list. Self-direction is less widely available for other populations. So that, there is self-direction out there for children, absolutely. But there are some kind of smaller populations where, depending on the state you live in, there may be an option to self-direct. For example, people living with brain injury or children who are medically fragile, but we're not at a place yet where that's kind of self-direction is the norm for these populations. But that's something that we're really going to continue to look at as we keep getting these snapshots of self-direction options every 3 or 4 years. Next slide, please. So again, if you're a data person, if you like visuals and graphs, if you're interested in terms of the number of programs available by these different populations, or excuse me, the number of states that offer self-direction for these different populations, you can see it here in case this is helpful at all. So again, adults, if you're an older adult and you're eligible for Medicaid in your state and you need long-term care, you probably have the option to self-direct. Same for adults with physical disabilities, if you meet eligibility criteria. But as you start to move into other populations, it kind of drops off, and that tells us that we have a lot more work to do as far as making sure that, if you need long-term services and supports, we're really working toward a world where you always have the option, even if you don't choose to self-direct at that time. Next slide, please. So one of the reasons why we saw this especially dramatic increase in the number of folks self-directing when we measured in 2023, we had last measured in 2019, which was right before the pandemic hit. And we heard very consistently from the states that we talked to that COVID really got a lot of people more interested in self-direction. So some of that was, a lot of states that previously did not allow what we call legally responsible individuals. And what that term really means is, for example, if you're married, in a lot of states, your spouse cannot legally be your caregiver through self-direction. Or, if you are under 21, for example, your parent often cannot serve as your paid caregiver. But during COVID, a lot of states were so concerned about, lack of availability of services and supports with all the pandemic-related kind of changes and disruption that they created emergency kind of temporary policies to allow those spouses, allowing those parents of minor children to serve as paid caregivers if they had not previously been allowed to do so. We've seen some of those changes be made permanent. Some states, it really was temporary, allowing, for example, your spouse to be your paid caregiver. And then in other states, we've seen, for example, some of that become permanent. states really felt that self-direction was critical in filling a void. As you recall, day services were really affected by the pandemic. They were closed for the most part, and so we talked to not only a lot of states but a lot of participants who told us, well, I used to go to day services and I couldn't anymore, so I started self-directing. And I hired my mom as my paid employee, and we liked it so much that we're going to keep doing that going forward, and I'm not going to go back to day services. We talked to a lot of folks that had kind of stories like that. So that was something that, again, we heard kind of on the macro level from states, and then kind of on the micro level talking to participants and families. And then I would say the last bullet here is that as many of you know, the pandemic created so much disruption that the federal government really decided to invest in Medicaid, and particularly kind of home and community-based services. They realized that the services and supports that people were relying on were really kind of pushed to the limit, pushed to the brink for a lot of people. A lot of people were dealing with service disruptions. So the federal government authorized kind of billions and billions of dollars for Medicaid, and specifically home and community-based services. If you hear us talking about ARPA money, it was called the American Rescue Plan Act, the ARPA. And ARPA really gave us just kind of billions of dollars of new funds, unfortunately on a temporary basis, but it allowed states to do some really cool stuff with their home and community-based services, including self-directed services, and also gave us some badly needed rate increases in a lot of states. So that was really, really helpful. Next slide, please. So just some additional factors for growth of self-direction. We continue to get kind of anecdotal reports that programs are continuing to grow. We're not going to measure them for another year or so again, but we keep hearing that there's a lot of growth continuing to happen. All indicators are pointing to that we're going to see even more growth when we next measure the kind of national self-direction enrollment. But things we'd like to know more about as we continue to study this are, number one, we really want to know how workforce shortages have kind of affected how much states are relying on self-direction. We would like to know more about whether the number of family members who are providing paid care is growing as kind of a percentage of the workforce. We'd like to know more about levels of unmet need among people who self-direct versus people who use traditional services, because we continue to hear some anecdotal reports that there are differences there. We'd like to know more about whether self-direction offers unique advantages as a way to support historically marginalized and underserved communities, including racial and ethnic minorities and people for whom English is not their first language. And going back to those 7 states where a decline in self-direction enrollment was reported, we'd like to know more about whether EVV or just kind of barriers to accessing self-direction, making that enrolling in self-direction process really challenging. We want to know whether those have been driving factors that are kind of pushing the rates of people who participate downward. So those are things that hopefully in a couple of years we'll know a little bit more about. Next slide, please. So that's the end of the presentation. Thank you all so much for attending. I hope this was helpful, and looking forward to some questions.
Yeah, that was awesome. Kate, love the last couple on the impact of COVID and how you guys have tracked that. And loved the last slide. Great stuff. So there are a couple questions. So when the surveys were done, what questions define that someone was self-directing? Meaning, how was the self-direction defined in the questionnaire? Great one. It's a great one.
A fabulous question. So the way that we determined it, and we realized this is not perfect, but the way that we counted whether someone was self-directing or not is that, when a state wants to receive Medicaid funding for offering services, they have to, there are literal checkboxes where they can say, the person can self-direct this, or this is, only a traditional provider managed service. And so we really focused on those services where the state had kind of checked the box that said, this is self-directed. Here, here are all the things that participants have the responsibility for managing in this model. And then when we were reaching out to states, we would say, how many people are receiving these particular services. So again, we're really going off kind of the state's definition. And we realize the real life is a little bit messier than that, but that was the methodology that we used.
All right, the next one. Is there a national standard to determine the grant levels, or do the states decide? So I think you and I know the gist of that question.
Yes, I don't know if you want to take that one, Mark, or I'm happy to.
Oh, you go. You go. Sure.
So, like so much of kind of self-direction nationally, so much is up to the state. States really have broad discretion over, again, most programs are funded by Medicaid, and states have so much discretion over how their programs are set up. So that's something that is pretty much 100% in the hands of states. They just have to meet some kind of basic federal assurances around, for example, making sure that it's equitable, that it's transparent, easier said than done, and things like that. It's really a state decision.
Last one, which is good. I don't know the answer to this one, and maybe you do. And the answer is, to your knowledge, is New Jersey moving towards permanent paid family caregiving? And I honestly don't know the state of paid family caregiving in New Jersey, Kate, and you may not either off the top.
I am not sure as far as permanent status. That is something I would need to research. I know there were kind of pandemic related changes, but as far as what the state is planning as far as permanent status, I'm not sure of that at this time. But there might be someone who knows.
I'd say that's probably almost like a classic example of how states can reach out to Kate in applied self-direction when they're considering things like this and get best practice nationally and get her expertise. And so those are all the questions. We sincerely thank you, Kate, for your time. As predicted, everyone learned lots of things on this talk, and we hope to see you again soon. And to everyone that's on the session, thank you so much for joining us for the Rise of Self-Direction session. If you could join us for our next session, which are two breakout sessions, actually, where you'll be able to speak with other attendees and program participants. The first one is Look at Me Now, the positive impact of self-direction and what it's had on participants' lives. And the second one is Can I Do This? Determining if self-direction can work for you. And Kate and I assure you, you can do it. And then we will look at you now when you do it. We assure you. So both of them are winners, and we thank you all for coming to the conference.